you all have along the way. We're going to talk a bit today about just some fundamentals of engaging your board members, leadership, and other stakeholders as you walk through the value-based care transformation journey. We'll talk a little bit about some of the other members' roles. We'll discuss developing a commitment statement for value-based care transformation, the importance of monetary investment in integrated behavioral health for value-based care, including what that return on investment might look like and how to assess that. And then finally, I'll wrap it up just with reference to a few of the tools that you might want to use when creating either the vision statement or assessing ROI. So you already heard who I am. So I am the CEO of HealthPoint. We're a federally qualified health center for the Brazos Valley. So we serve a 9-county region. And so we're both in a suburban area, Bryan College Station, as well as in the surrounding counties, which represent some urban populations. And so depending on which one of our locations that we're talking about, the need for services and supports in a value-based environment looks very different. But so just to get us started, I want to hear a little bit about where you all are from. So you'll see the poll pop up here. Let us know the city name where you're from, just so I can get an idea.
Can you give me okay, I think we have started to get some responses.
We have our answers now. Looks like everyone answered.
Yes, so I'm going to end the poll and share. Victoria, are you able to see the response, the result?
Yes, so we have 9 out of 9 who answered, but I'm not able to actually see the answers.
Anybody else on the screen are able to see the response? I just shared the result. Okay, because on my end, I don't know why I'm not able to see. I can see like 9 out of 9 responded, but not able to see the response.
That's where I am as well. So I'm going to go ahead and get started while you all see if you can figure that out and give me some insight as to who's in the room and where we're all from. So just to get started, we're going to talk about fundamentals of engaging your board members, senior leaders. So value-based healthcare transformation requires the engagement and support of board members, senior leaders, and other key stakeholders, both within and outside your organization. These individuals may or may not carry a title denoting what their leadership capacity actually is. But when we're talking about these folks, they have the ability to drive change, develop strategy, and champion initiatives that prioritize value-based care over our traditional fee-for-service models. And they may have the ability also to unfortunately undermine this transformation if they don't understand or value the work being done or our desired future state. So, hold on, we're going the wrong direction. So what I want to talk about is how to best engage them and recruit them to be champions to support your goals in value-based care transformation. So some of the things I'll talk about is, what is a champion? Education, alignment with mission, vision, and values, starting at the beginning, collaborative decision-making, recognize and reward performance, and creating a culture of curiosity. So first, with regard to champions, when I'm using that terminology, champions are those individuals that have the influence, expertise, and passion to drive change and motivate others within your organization. Once engaged, they may act as a catalyst for change, promoting transformation and adoption of new principles and practices. So your board members and senior leaders are essential to support change and may be able to use their positions to advance value-based principles through policy, decision-making, and messaging. But make sure you don't overlook the impact of site-level managers, providers, and just thought leaders within your organization who can also successfully use their close proximity and expertise to support change. So engaging stakeholders as champions typically begins with building their understanding of the value-based healthcare model. It involves providing educational resources, promoting workshops, and conducting training sessions to enhance their knowledge about principles, benefits, and potential challenges that are associated with value-based care. So it really starts with the why. We use the why terminology a lot in our organization, and try to train new leaders to make sure that when they're asking folks to shift, that they start with that why. By supporting their awareness and education, those stakeholders can then grasp the significance of transformation and its potential to improve patient outcomes while optimizing costs. In addition, you can build some urgency and momentum necessary to take on the challenge. As with anything new, some individuals require more time with the concepts and will have more questions or concerns than others. And to effectively engage key stakeholders like board members and senior leaders, you're going to need to be able to effectively communicate the alignment between mission, vision, and values and the principles of value-based care. With regard to your board, consider building this connection through the strategic planning process, where you can help ensure the strategic priorities established by your board and the goals established from those priorities reflect not only your mission, vision, values, but recognize the challenges ahead and recognize and celebrate achievement of key milestones in the transformation. So anyone who's been through this process will tell you it's a bit of a marathon, not a sprint. And so making sure folks have an understanding of those key milestones and are able to follow along with transparency is really essential to helping them stay engaged with you and understand that you're making progress, albeit not quickly at times. In particular, in organizations that have pride in longstanding traditions or methods, it's really critical to help those board members and senior leaders understand the new principles as being an enhancement to and not a departure from your mission. You might even consider use of graphic representations, themes, or slogans. I know it sounds cheesy at first, but it allows you to continue to link back even small messages to the overarching principles. So it'll give you something to anchor to as you move through, because there are so many kind of different pieces of the transformation process. Being able to link them back to a central theme is really helpful. And a clear communication that illustrates sustainability of your proposed future state and the positive impact on quality of care and patient satisfaction will make it more likely that boards and leaders will be able to champion value-based care initiatives. So one of the things that we talk about with our leadership team is making sure we're starting at the beginning. So just as most of us learn to crawl before we walk and walk before we run, your transformation is likely going to start with small pilot programs that embed key elements of value-based care within the organization. So look for connections where a pilot might be the answer to a long-standing challenge faced by a key stakeholder. That's another way to gain their buy-in, because their engagement in developing this small solution helps reinforce the value for them and creates an opportunity to develop those small wins and success stories that can be shared with others before you then spread that either new department or proven concept across a larger aspect of your organization. You can also spotlight these successes to build your organization's confidence in both the value-based care principles, but also your organization's ability to drive intentional change. Organizations that have not been through a lot of transformational initiatives may not have a great deal of confidence, and the staff may not have a great deal of confidence in their ability to do this work. So those small wins are how you're going to start to build that skill set. You want to make sure that you recognize and reward performance. So recognitions and rewards may serve board members and leaders to champion value-based care transformation. I realize that in many of our organizations, particularly in mine as a federally qualified health center, we can't compensate our board members in a monetary manner, but seeking opportunities to recognize that extra commitment of time and effort by our board members who champion transformation helps to galvanize that support provided by the board. Reward and recognition also reinforces the efforts of staff who sometimes feel disconnected from leadership or even from the board. And so when we tie all these pieces back together and celebrate the success that we have when we work together, it helps support all layers of the organization. And you want to encourage the board to support movement from that pay for performance by supporting things like career ladder opportunities that recognize and reward your high performing staff. And if you have any built-in organizational incentives, make sure they are aligned with your strategic plan-driven priorities and goals by using value-based metrics, things like improved patient experience, targeted outcomes, which then also tie back and reinforce and encourage the transformative process. Collaborative decision-making is another key piece to that engagement. So engaging your board and senior leaders in decision-making processes helps them to appreciate the impact of their own voice and their perspective in the transformation. So their contribution to the design and implementation of the value-based care initiatives enhances their engagement by fostering a sense of ownership and accountability for this process. Demonstrate respect for the governance function of your board with regular updates from key change makers. The way we do that is each month there's a different senior leader, our chief operating officer, our chief nursing officer, our chief medical officer will come in and provide progress reports. And that will allow them to see the team working together, the team supportive of the transformation, and also let them track the progress in those milestones that we spoke of earlier. And data-driven insights on dashboards help facilitate some of that transparency. And then finally, create a culture of curiosity. So, you know, change in healthcare. I remember when I first started to feel change occurring in healthcare and thinking that it was just something we were going through in the moment. But I think today, a lot of us have come to understand change in healthcare as the norm. And so we understand our field to be continuously evolving. So creating that culture of curiosity helps support continuous learning and development that's necessary to continue to adapt and grow, both as individuals and as an organization. So support your team members who ask why by researching and thoughtfully responding, or inviting further inquiry by subject matter experts, either within or outside your organization. Sometimes I've had to bring in a consultant to, you know, help answer a question on a deeper level. I've even had a situation where we had to inquire with an attorney to make sure that we could answer some of these questions by our team members. But I don't want to silence the questions. That's part of how people kind of dig in and engage, but instead, you know, bring them education and information. Also, as you're bringing education to your board and key stakeholders, make sure it's in small digestible pieces that doesn't make them feel out of place or burden them with jargon or detail, but instead invites them to join the transformation. We found that, you know, small sessions, 20 minutes here, 15 minutes there, time after time with our board, has them where they can, you know, sing along with you in the next meeting you have when you start to discuss some of the initiatives. They really have followed along. The terminology is familiar, and then they can start really thinking about what that transformation looks like. So encouraging professional and personal development of board members and senior leaders and other team members helps to support the organization in remaining current on best practices and also your standard of care, despite having something of a moving target when you're talking about healthcare. So at the end of the day, with regard to engagement, engaging board members, senior leaders, and other influential stakeholders as champions in your value-based care transformation is critical to achieving sustainable change. By educating, aligning objectives, achieving small wins, and supporting collaboration, recognizing and rewarding those who support change, and in creating that culture of curiosity I spoke of, leaders can engender the support necessary for the transformation to value-based care. So next, I'm going to step into a conversation about some of the different team members' roles in the value-based care. But before that, I'm curious about what capacity each of you might serve in your organization. So are we ready to launch the next poll?
I am going to do that, but I'm trying to figure it out. I think Victoria, you started the poll.
I'm trying to.
It says
It doesn't
launch.
allow me to launch it. The button itself is like, no.
You know what? Let's just continue all of our poll questions into the chat and I can just read that out loud. I'm sorry, we're having some technical issue today.
All right, well, I will continue forward.
So we have providers, executive leadership, behavioral health administrator, board members, academia, and quality staff.
Oh, excellent. Well, that's a nice diverse group. So that's great. So you're going to hear something for everyone in here. So, future success in a value-based environment requires engagement and support of various members to drive the delivery system transformation. So from quality improvement to coding, staff across the organization can all contribute to the successful implementation of your value-based care initiatives. So I'm just going to go through a small sampling of roles and responsibilities of some of the key team members. And this is just based on the perspective of our team's transformation. So first of all, our senior leaders. So our senior leadership team was responsible for steering the organization towards value-based care. And so what we saw as their key role was developing the vision and providing guidance for implementation of the value-based initiatives. And so we did that in such a way as to make sure we were aligning mission, vision, and values with board-driven strategic priorities and goals. And the goals, ideally, when you do this, are developed by senior leaders in response to the board priorities, and they support collaboration and ensure that you have the necessary resources allocated to support the transition from to value-based care. You also want to make sure your goals are SMART. So I suspect this terminology is familiar to most folks, and we'll talk about it a little bit in the tools as well. But when I say SMART goals, I'm talking about goals that are specific, measurable, achievable, relevant, and time-bound. And that way you can start to address some of those timing expectations, because some of your novice board or team members may not be fully prepared for the time commitment that is involved in a transformation like this. It really is an endurance exercise. Senior leaders can also serve as advocates for change and make sure that you maintain a patient-centered approach through the transformation and align stakeholders so that you can achieve sustainable improvements in access, quality, and cost. So our quality improvement staff were invaluable. And when I talk about quality improvement staff, I'm talking about staff from a variety of potential departments. It just depends on kind of the configuration of your organization as to where they reside, because they might be from information technology, quality, or even nursing. And they play critical roles in the implementation and development of value-based initiatives. Some of the places where we had some key roles were in data collection and analysis. So staff skilled in data collection and analysis can reside in one or more departments in your organization, but their ability to collect and analyze data related to clinical outcomes, patient experience, utilization patterns, and cost helps provide the information necessary to identify those opportunities for improvement that you're looking for. They may also help you establish benchmarks and track your performance against targets or goals, and generate reports to inform decision-making and drive quality improvement efforts. Your quality improvement staff. So this is an interesting piece, because I know in the organization I'm in today, when we talked about quality improvement initially, it was a corporate function, but to prepare for this journey, we shifted to quality improvement led from the front of the organization, so that people doing the work were improving the work. But the challenge is that those people doing the work also had a full-time job. And so they did rely heavily on having some people that were quality improvement staff that were trained in evidence-based guidelines, protocols, best practices to support value-based care. And so they helped inform and educate those individuals so that when they were driving that improvement from the front of the organization, they were well informed. Your quality improvement staff may also provide framework and expertise to support pilots of new workflows using a PDSA or other quality improvement tool or model. So also included when I'm talking about quality improvement staff are the staff that provide population health, complex care management, and care coordination functions. So these are some folks that we added as part of this journey that didn't exist in our system prior. And so patient experience, utilization, and outcomes may be managed by a variety of different clinical team members other than the primary care provider. And so for us, we added population health coordinators that could coordinate preventive care initiatives, promote patient engagement, empower patients with access to local resources and complementary services. We also added some complex care managers. They were really addressing patients that were identified through risk stratification to make sure that we had intensive support for those patients that had complex medical conditions, multiple comorbidities, or other indicators of risk. And then finally, care coordinators were used to help assess our patient needs and preferences and goals so that we could facilitate navigation within the larger health system with attention to referrals or even communication within providers, or between providers, rather. So I have another poll question here. I'm going to keep moving, and so you'll see it pop up in the chat, hopefully, and be able to answer. But do you anticipate needing to hire a medical coder as you transition to a value-based environment? So, and I asked that because while we did have coding expertise that was attentive to billing, we had to look at coding expertise that could support our provider teams in making sure we were capturing those CPT codes and accurately capturing the acuity of our patients and all the interventions that that we were performing, so that we were really understanding the work that was going in to supporting given patients. So for different organizations, these skill sets may reside in different places. So I'll talk about coding practice with your fiscal staff, but I'll let you know we also have coding expertise that's working with quality and compliance for us that provide some of that education. So, you know, your fiscal staff are critical to ensuring that you have accurate and timely reimbursement for your services, but some of the pieces that are really instrumental in value-based care are your coding practice. So you can make sure that your providers and other team members are educated and equipped to accurately document and code the patient encounters. Making sure that you have accurate coding is essential for risk adjustment, panel management, assessments of acuity, and attribution for value-based initiatives and capture of outcomes. So they may, like I said, live in fiscal, compliance, or both, depending on the size or complexity of your organization. Claims processing, billing managers and other claims processing professionals help manage your claim submission and processing workflow, and making sure that your claims are accurately coded, documented, and submitted to payers in a timely manner is really important in these environments. So they have a vital role in facilitating a smooth revenue cycle and optimizing your reimbursement. So successful implementation of value-based care, as you can see, relies on efforts of all team members. I just kind of picked on a few, like senior leaders, to provide strategic vision and leadership. I called out staff that support quality improvement so that they can drive transformative care initiatives and data analysis. Clinical support staff help enhance your patient engagement, promote effective utilization of resources, and fiscal team members help ensure accurate reimbursement. So by recognizing the contributions of each of these team members, your organization can foster the collaboration that's necessary for transforming care delivery and improving patient outcomes while you control costs in the value-based environment. So here's another poll question that you'll see pop up. So do you anticipate needing to hire a medical coach? Well, we saw this one already. Hold on. We went the wrong direction. Okay. So now we're going to talk a little bit about developing a commitment statement. So a commitment statement's a little bit different than maybe some of the tools that you're accustomed to with mission, vision, values. A commitment statement is an affirmative declaration of your organization's mission, vision, and values that has attention to key principles like value-based care, patient-centered care, diversity, equity, and inclusion. And so for this discussion, I'm going to assume that we're developing a commitment statement with intention to align your board, your organizational leaders, staff, and other stakeholders in driving value-based care in a transformational process. So some of the key considerations when you're developing the commitment statement include engagement of stakeholders, mission and vision, value-based and patient-centered principles, your organizational strategies that you already employ, and transparency and accountability. So I'll spend a little bit of time with each of these. So we talked a bit already about engagement of stakeholders. You know, the engagement of stakeholders is essential. Inclusion of diverse perspectives and insights as you develop your commitment statement is going to help support engagement and a shared vision for the future. The diverse perspective and insight will make sure that your vision for value-based care and patient-centered objectives can be supported by everyone in your organization. So here's another poll. What is your biggest...
Answer these questions into the chat, please.
Okay. So for this poll, we want to understand, what is your biggest hurdle at this moment? Is it wanting that greater understanding of the need to accomplish this goal, or a greater understanding of the benefits that will flow from the transition? So as you develop that commitment statement for value-based care, you should begin with your organization's mission and vision. The mission statement, as you know, reflects the organization's purpose, objectives, and may even start to describe how those will be met. You may hear...
Dr. Sabella, we've gotten some response from that previous question. And Gail has mentioned that the biggest hurdle has been greater understanding of the benefits. And that has been the 2 responses so far, understanding the benefits.
Perfect, thank you. And we'll start to tease some of that out as we talk through this. So thank you for that feedback. So, you know, some of the terms you hear in your mission statement may include high quality, patient-centered, evidence-based, value-based. And so the vision is distinct from the mission statement in that it's an aspirational picture of your desired future state, right? So it describes what you hope to accomplish. And so in a vision statement, you may hear measures of clinical outcome, patient experience, or cost effectiveness.
Dr. Sabella, Eric has said that payer support and financial roadmap for behavioral health. We have a lot of historical data on the TCC savings from behavioral health integration, but payers are hesitant to designate the cost savings to behavioral health activities.
Yes, yes. Thank you. I appreciate that feedback. And you're going to hear some of that echoed when we talk about ROI a little further down the line here. So as you're developing your commitment statement, you want to make sure that your key principles woven into it help demonstrate the organization's commitment to value-based and patient-centered approaches. Your principles should be defined and prioritized, and make sure that they're consistent, again, with your board established strategic priorities and organizational goals. So it sounds like some of you have already begun the process of transitioning to value-based care, or have at least contemplated it. So this should be an easy one. Do you see folks answering this one in the chat?
Yeah, we have some response, a couple of yeses.
Okay.
No. We have 2 yes and 1 no.
Okay. All right. So you have some variety here of stages that folks are in. So again, with regard to value-based and patient-centered principles being included in your commitment statement, some of the principles of value-based care that you might want to include in your commitment statement are things like patient outcomes, effective care coordination, population health management, engagement in preventive care, or optimized resource utilization. When talking about a patient-centered approach, you may describe with principles such as patient engagement, effective communication, culturally competent care, respect for autonomy, or even shared decision making. So in the commitment statement, you're going to want to describe the strategies that you're going to utilize. And your strategies may include things like updated or upgraded technology or tools, new service lines or programs. Like I spoke of earlier, we didn't have, before we started this journey, population health or care coordination. We added a population health software. We upgraded some of our tools and moved to a higher level of integration. We added engagement with an HIE. So some of those strategies will be things that you might want to include or reference in your statement. Those strategies should also be aligned with your sustainability plan and the resources that you have available. So I think that this is one of the most important pieces to not only articulate in your commitment statement, but also to make sure you're being really attentive to for the purposes of engagement with your stakeholders, and that is transparency and accountability. So you want to include it with your commitment statement because you do want to be able to articulate how and where folks will receive indicators of progress. You'll want to establish key performance indicators and targets that reflect your organization's objectives and goals and align with your strategic plan. And you want to report on these in such a way that your leaders can regularly monitor and report on these KPIs using data to course correct as needed. You know, some of the challenges that we had on day one were some of the folks in our organization wanted to be able to lay out the 10 steps to get to our goal on day one. And some of the challenges, if we put all 10 steps to get to our goal out on day one, most certainly by the time we got to step 3, step 4 or 5 might be incorrect. And so we had to get folks to a place where there was an understanding that transformation might be a little bit messy. It may require some course correction, but if we had adequate transparency built into the system and we had KPIs to help us understand what we had achieved and where we are with regard to our milestones and our goals, then we could rapidly course correct so that maybe when you're on step 3, you're redesigning step 5 because things haven't moved exactly as you expected. So again, this transparency and accountability piece shouldn't be taken for granted because that review and refinement is really critical. And it may require that you review and refine your commitment statement as well at regular intervals so that it can be a source of guidance and motivation for your teams to understand where you are on your journey. And then finally, what good is a commitment statement if you haven't communicated it to anyone? So you have to effectively communicate the commitment statement across your organization and beyond. And you'll need to use various means. And it's just been my experience, if I say something one time, it really doesn't go much of anywhere. It requires me saying things multiple times. I'd say minimum 3, really more than that, and using a variety of platforms to get a message across. So for our organization, we use staff meetings, newsletters. I developed a quarterly webinar where I share kind of our progress on our journey. We have different pieces like those pilots I talked about earlier that are called out on social media. So lots of communication across various means. And then also encourage leaders to champion the commitment by aligning activities with the commitment and then making that connection back to that anchor for staff. So that when they do something and they do it well and it's consistent with the commitment statement, that you tie it back for them. So next, I'm going to spend a few minutes talking about the monetary investment in integrated behavioral health for value-based care. So this is one, this was, I think, probably one of the more difficult pieces for our organization for a variety of reasons. As I go through it, I'll kind of point back to it, but the return on investment is part of what we need to talk about, because I'm not sure we're completely where we want to be in understanding the return on investment. But it's really an important concept in fully appreciating the value of integrated behavioral health and other value-based initiatives. If you look at the resources that I've tagged on this presentation and here below, you'll see a reference to the AIMS Center, and it's because we adopted the AIMS model for integrated behavioral health in our organization into primary care. So, for us, developing enhanced care coordination and outcomes has been essential. So the development of robust care coordination programs requires monetary investment in integrated behavioral health. So for us, we have behavioral health integrated into those complex care management and care coordination teams, so that those folks are available, whether it's for brief interventions or other sidebar consultations. But we know in the data coming out of the AIMS Center, it's been demonstrated to improve the coordination of care, patient outcomes, and patient experience when we have those integrated behavioral health team members on board. With regard to the value of prevention and early intervention, prevention programs, whether it's behavioral health screening tools or evidence-based early intervention like SBIRT, have been demonstrated to provide early detection and intervention for many behavioral health issues. And so investment to support development and implementation of strategies to address behavioral health issues alongside those physical health conditions can improve overall health outcomes and promote preventive care, leading to healthier populations over time. It has the potential to reduce the burden of chronic disease and create a healthy society over time. And that's what the literature tells us. Although I will tell you, I've found the ROI to be a little difficult to measure for reasons related to the total cost data access. So we've had some challenges gaining timely access to total cost data. So we're still very much at the beginning of that particular journey. And then also the time commitment. I talked about this as a marathon and not a sprint. And so some of the investments that we make today are going to improve total cost of care with impacts that may be 5, 10, 20 years down the road. And so I'm not sure that we have the experience to fully capture and appreciate that in a way to build it into our ROI just yet. Reduction in healthcare utilization and cost. So proactive management of behavioral health conditions may help prevent more acute care episodes or progression of a condition that goes unaddressed. While it requires investment in prevention and screening for early recognition and treatment with integrated behavioral health, it may serve to reduce emergency department utilization, hospitalization, and improve quality of life for the patient and their family, resulting in an overall reduction in cost of care to the patient, payer, and the healthcare system overall. I think that's particularly true. I didn't get to hear where you all are from, but I can tell you where we're from out here in the Brazos Valley. We have very limited access to more acute care for behavioral health conditions. And so for folks who are or under served with regard to primary care or behavioral health, sometimes it just means that these issues are not addressed, or they are not addressed until they really are in an emergent state, which makes it costly, and they have to go out of town, and it's disruptive to their lives. So this early intervention is invaluable in communities like ours. But as I said before, when taking a look at the ROI on that monetary investment, it is challenging because while we're working with our payers in newer ways than we have before, and I look forward to seeing more of that total cost of care data so we understand the impact we're having. As of today, I think we still struggle to be able to articulate our value. Improve patient experience and satisfaction. I already spoke a little bit to this, but the fact of the matter is providing patient-centered and comprehensive care that holistically treats a patient as an individual, addressing both their physical and behavioral health needs in an integrated fashion, really helps to improve the patient's overall well-being, is more convenient for the patient, and increases the likelihood of engagement by the patient. Again, particularly true where you're serving a vulnerable population that may be challenged with transportation issues, time away from work, and other competing obligations, or even additional co-payment amounts. That's been one of the challenges we've had to address. You know, even a small co-payment, a $10 or $20 co-payment, when you talk about someone who needs to see a behavioral health specialist multiple times in a week for a short period of time, can be such an intimidating burden that really having it integrated in that into that primary care team helps to address some of that. And then with regard to the economic benefits and return on investment, I've been discussing this throughout, but in a value-based environment, healthcare organizations with contracts that allow them to benefit in reduction in total cost of care are going to be able to yield some economic benefits for their monetary investment in as those contracts today, and not everyone sees that total cost of care data. But the more we have transparency around that, we'll understand the fiscal effectiveness of our investments. And when we're able to calculate and articulate that ROI and understand the financial impact of our initiatives, and that's including reduction in healthcare costs, improved patient outcomes, and even our own enhanced operational efficiencies, we'll hopefully be able to demonstrate that positive ROI, which will justify not only the initial investment to our stakeholders, but also support sustained commitment to integrated behavioral health and other value-based strategies and models. Just to wrap up this piece of it, financial investments in our integrated behavioral health and value-based care models are critical to make the transformative change in healthcare delivery and improve our patient outcomes. And by being able to assess ROI, healthcare organizations will be able to determine whether their investments in integrated behavioral health and value-based care strategies demonstrate positive financial outcomes towards sustainable health care systems with improved patient outcomes and experience. At this point, it feels like a little bit, we're working a little bit blind, but I know in our organization, our commitment to the patient and the improved patient outcomes has led us to go ahead and make this investment. And we're working through the transparency and data piece of it so that we can articulate value. So now I want to talk through a couple of tools. I'm not going to spend a lot of time on these because I think most of these are tools that are familiar to you all, but I just kind of want to tie it all together for you a little bit. So when creating your value-based care vision statements, there are a couple of familiar tools that you might consider leveraging. So one is your SWOT analysis. So, conducting a SWOT analysis to assess your organization's internal capabilities and external factors that may impact value-based care will help you identify any strengths that you can leverage, weaknesses to address, opportunities to seize, and potential threats to overcome. It also helps align the vision statement with your organization's unique character. So every organization is going to look different in their SWOT analysis. And so it may help you prioritize those items that belong in your vision. I've spent quite a bit of time on stakeholder engagement. So, but when you're creating your vision statement for value-based care, make sure again that you engage your key stakeholders in this vision development, your board members, your senior leaders, your providers, staff, and patients. And you might think about how to incorporate each of these voices. You might consider use of group work sessions, surveys, supported conversations so that you can gather the perspective, insight, and expectations of each of these different stakeholders. But using a collaborative approach like this helps ensure, again, that the vision statement reflects the diversity of your organization and the individuals that it serves. Make sure that you go ahead and review your existing mission statement and values to ensure that you have alignment with the future value-based vision. So consider stakeholder accessibility, determine if updates or modifications are warranted or desirable, and ensure that the vision statement is complementary and supportive of the organization's mission and values as well. When we did this, we actually ended up paring down our values quite a bit. It's not that there was anything wrong with the values that we had, other than the fact that there were 9 stated values. And when we were talking about the vision, folks could articulate the mission, the new vision, but when they got to the values, there were too many of them. And so we had a team that kind of sat down with them and were able to cluster them with a mnemonic that we call the 3 E's. So that, again, it's something that's accessible to your team to help them get behind. So I think that this poll question might be a little bit in the wrong place, but it's still a good poll question. So are you using KPIs in your practice currently?
I'll watch the chat and see if we get responses.
All right, and I'll ask you about that before we get to the next section on the tools for creating ROI, because that's where I want to talk about that. All right, great. So, but I was talking just a minute ago about having to change our values a little bit to make sure that we had something that our team could speak to, like the 3 E's, instead of having 9 separate articulated words. So similarly, use clear and inspiring language. So something that communicates the value-based care goals of your organization and resonates with your audience. So emphasize that you are taking a patient-centered approach, that you're looking for improved outcomes, cost effectiveness, and population health in the future with some impactful word choices. And although it may feel a little cheesy when you get started, You might consider a mnemonic, an acronym, or even a graphic representation. I know our team leaned into this a bit, and so now they have t-shirts and all kinds of other things, but it's just a reminder, and again, creates opportunities to kind of tie it back to some anchoring language, so that you keep everyone engaged and moving in the same direction. SMART goals. So you're going to want to, again, look at those SMART goals when you're developing your vision statement. So your vision statement should lend itself to the development of goals that are specific, measurable, achievable, relevant, and time-bound, and support value-based care. So your vision statement might reference some of your aspirations like patient satisfaction, preventive care, or some specific quality metrics that you intend to work towards. Then you could create some goals that are ambitious yet attainable and align with your vision, to your so that it aligns your strategic objectives with your overall vision. You have another participant poll here. So this one is, what is the most intimidating aspect of the value-based care transformation? And I've kind of put it in some broad categories here, just kind of thinking of some of the things that we have found challenging, just to kind of see where we all are. The greater understanding of the need so you can gain that stakeholder buy-in. Is it financial constraints that prevent the transformation? I know that this was a challenge for us at one point. Is it the ability to demonstrate that ROI? You know, we talked about some of the challenges that you might have in demonstrating ROI. Or is it hiring challenges? Or is there something else that I'm just not even thinking of and that we haven't discussed yet?
So we have a couple of responses to this question. We have 2 that say financial constraints, and then 2 that says ability to demonstrate ROI.
Right. I think that those are related and very, yeah, I think that is a common challenge. So finally, as I wrap up the tools for creating the value-based care vision statement, make sure you revisit your vision statement regularly. So while it should take a long-term perspective, you're going to need to revisit it regularly so that you can, again, update or course correct. You know, our healthcare environments are dynamic, and a static document may stifle your nimbleness and creativity. So regularly review and refine your vision statement so that it can remain relevant in the ever-changing healthcare landscape and align with your emerging evidence-based practices and your organization's unique environment and priorities. We have one more response. Eric says, I think the other issue with VBC is payer alignment. Tough to have fee-for-service with 3 payers and value-based care agreements with 2. Need to bring all payers along at the same time. Yes, there's a lot of tension created when you're straddling those 2 models. I know for us, some of the conversation that I had at the board level was we had to position ourselves so that we could invest in developing some departments that were not going to be sustainable for 2 or more years, which, depending on your financial position, for some organizations, that may not even be an option. For other organizations, it may be a bit of a trust exercise, and we did put together sustainability plans, but again, our sustainability plans did not demonstrate even break-in for 2 or more years for some of the departments that we were developing. And so getting your board comfortable that they're doing their fiduciary duty, and that they're adequately serving in their governance role while watching you report a negative margin for 2 years can be a bit challenging. It certainly is easier if you have payers and partners who are willing to help invest in this so that you can at least be in a break-even position so that your organization feels safe and sustainable for the future. But I realize for a lot of organizations, that's not the position. And when you have one payer that wants you to move to a value-based contract and the others not in that environment, it really kind of prolongs that time frame where you have teams that are not fully sustainable. So I appreciate that what Eric's saying, that is quite a challenge. So I've listed a few of the tools that you might consider using to create that return on investment or to show how to validate. These are probably familiar to all of you. So, doing a comprehensive value-based cost-benefit analysis helps stakeholders in evaluating the financial implications of any investment that you're asking them to make in a value-based care transformation. You can, quantify and identify and quantify associated costs and prioritize where you use your funds. You'll probably be making investments in infrastructure, technology, additional personnel, training of existing personnel. So those all can be expected. You can try to project potential benefits with an understanding of how the financial benefits may or may not directly impact the finances of your organization. It might also help to discuss with your payers and other partners so you can identify necessary supportive funding, whether that's grant funding or whether that's changing the relationship that you have with your existing payers. Sustainability plans should be developed where reimbursement is available to understand how a strategy can be optimized to perform over time. You can also invite your governing board to help you draw some lines in the sand. So we talked a bit about that with our board about how long we would be comfortable in the position. How far are you going to be comfortable letting that rainy day fund go before you need to start making hard decisions, but making sure everyone understood the consistency of what you were doing with your mission, the value that it presented from a non-monetary standpoint, I think was helpful, and then kind of drawing some of those lines. For nonprofit healthcare organizations, it's helpful to distinguish the difference between a cost-benefit analysis and a cost-effectiveness analysis. I put a reference in the presentation. I think for a lot of us in nonprofit healthcare, more frequently what we actually use is cost-effectiveness analysis to justify investments when we're serving vulnerable or unfunded populations. But when you're moving into this new environment, cost-benefit analysis is really going to help you in validating some of the investments in making the change. Key performance indicators, I've spoke about these a bit. So key performance indicators that align with your organizational goals related to value-based care should be developed, defined, and tracked with a dashboard approach. So your KPIs may be things like improved patient experience survey scores, changes in emergency department or specialty care utilization. Again, that's assuming that you have access to that data. Use of preventive care or health screenings. And those KPIs will allow your leaders and other stakeholders to track the impact of your strategic initiatives and support refinement to optimize the ROIs. I realize some of those measures, if you're strictly in a primary care environment, are things that you're going to have to obtain through your payer. But I think that's one of the places that you can create conversation. I know for us, when we started looking at total cost of care, we needed to know about emergency department and specialty care utilization and home health utilization. And so that was a space where we really started putting our heads together with the payer partners and talking about how we shared that information and what we were doing in terms of interventions and watching to see if we were having impact. So having access to that data is key. Some other tools, your traditional data analytics within your organization. So most folks probably have access to their historical trends and data and can look at patterns to help project potential impact to patient outcomes and finances when you employ a particular initiative. So it may also help you when you are trying to compare the change in your organizational finances from a fee for service to a value-based model to understand some of the patterns that align with where you've been as you're looking forward to where you're going. So data that demonstrates potential cost savings and revenue enhancements, again, may be limited based upon the payer and contract types that you have available. So some of your initial projections may be somewhat limited. And I'll just say, and it's probably a little bit preaching to the choir, that I recommend a conservative approach in those transformative years. We did take a very conservative approach in our initial projections. I'm pleased to say that we've outperformed all of our conservative, projections. So that's the good news. But I was glad that we took that approach because I feel like we adequately prepared our board and our staff so that when they saw the initial phases where the numbers were not what they were accustomed to, instead of being upset or concerned, they were, yes, this is what we were expecting. Yes, apparently the changes are doing the things we expected them to do, which gave them a little bit of confidence that things were also going that the longer term projections were also going to be as accurate, but also bought us a little bit of patience to get some of these initiatives stood up because again, they weren't going to be successful on day one in terms of finances. I'll tell you, on day one, they were
Doctor, are y'all able to hear her? No, right? She frozen
No.
for you too? Okay. Not sure what happened.
My sense of her when she said they set low expectations.
Let me shoot her a quick email and see. Oh, I think her server went down or something. I'm so sorry, everyone. I think she lost her internet connection. That's why.
or social service organizations in our community. Others are hospital partners here locally. They assist us not only in data, but resources for our patients, because you know, we can't do it all by ourselves, particularly in our patients that have very challenging situations. So there's a list of some of the references that I provided, but happy to take any questions that you all might have.
I would have guessed that it would be easier for FQHCs to be able to do value-based care since CMS is on the front, but it sounds like it's been just as challenging for you as an FQHC to get value-based care implemented.
I think that that's true, Patty. So there's been a lot of discussion, and I feel like because we're an FQHC, they try to align some of the incentives in terms of patient outcomes and quality of care. But as far as that financial investment piece, that part didn't happen. We kind of had to create that for ourselves, which for some health centers, depending on your payer mix and where you're located and the resource levels around you, it's tougher for some than others.
That also makes the information you shared can be valuable to all systems beyond just those that have more federal funds. So I appreciate that. It's a good presentation. Thank you.
Thank you. Thank you.
Yeah, Terry, that was excellent. So I know the answer to this, but I'm going to ask it anyways. How much was the transformation dependent upon getting some outside experts to help you along the way?
You do know the answer to this question, Dan. So I've done this in a couple different organizations now. And I'll tell you, in both cases, we really weren't able to gain significant momentum until we brought someone in from outside. I don't know that they were saying a great deal different than what some of our leaders could have said, particularly those who have already experienced the transformation before. But it really requires some structure and intention. And so having somebody come in from the outside that had a framework, that had the literature in hand and was able to provide, was invaluable. And I think I've told our team here in-house, I think we did in 2 years what probably would have taken us closer to 10 without that support, to be honest. And so Dan knows we used HMA. So when I was in the Austin area, we used HMA to start this process. And then here, now that I'm in the Brazos Valley, we brought HMA in again. And in fact, we just finished one engagement with HMA, and we had them signed on for a second engagement. The first one was really about developing population health coordination and CCM and COCM and TCM and all these other pieces that our teams there's basically service lines that we didn't have before. And then the piece that they're working with us on now is around team-based care, because having these other team members is great, but it's only part of the equation, because part of the challenge that we face sometimes is we have a lot of very dedicated and experienced providers, and they are used to being the only resource for their patients. And so when you have a physician or a nurse practitioner that goes in the room and tries to be not only that primary care provider, but also the dietitian and the clinical pharmacist and the social worker and everything else. That is your provider that is stressed out, burnt out, exhausted, struggling with the number of patients on, on their panel and on their schedule. And so you can put the pieces in place to try to provide them with that relief. But until you build the transparency and accountability so that they know these people, trust these people, are comfortable handing off to these people, that their patients will be cared for in a way that they understand. I think so. That's the next challenge that we have where I am now, is really kind of moving the culture to that team-based model so that they're comfortable making those handoffs. One of the other challenges that we've had culturally that we're working on, a little bit of this engagement will support that, but it's a bigger picture issue, and some of you may have felt it already, is with behavioral health. We initially engaged with one partner to provide behavioral health providers, and we were talking about integrated behavioral health. Those are the words we were using, and then we kept kind of butting into one another, and so finally had to sit down and have a discussion about what were we talking about when we said integrated behavioral health. It doesn't feel like we're talking about the same thing, because they wanted to put a bunch of behavioral health resources in a single hallway in a single clinic so that they were all next to one another and seeing patients for 40 minutes at a time. And I was saying, no, that's not what I'm talking about. I'm talking about, I want the behavioral health provider in the clinic with the primary care providers. And yeah, they can have probably a handful of longer sessions during the day, but it needs to be broken up with some time where we can just grab them and pull them into a room so that they can help us with the screening and the expert and all of this, because we know that so many of our patients can be effectively managed by our primary care provider if we get them on the right track, but they need that initial interaction with behavioral health to kind of get the team aligned about how we're going to handle this moving forward, right? And save those counseling resources, more intensive resources for the patient that needs them, because we have those patients too. But we don't have enough of that resource for everyone, right? So if we're going to do this effectively from an organizational standpoint and for the patients, having it really integrated with that primary care team is more effective. And so they did not see it that way. They did not understand that. So that's the AIMS model that we put in place. And so we had to find a different partner that's now supporting us in that. And some of what we're using is telehealth to make that possible, because hiring is very difficult too.
Just a clarification on what you just said. Are you saying that the mental health provider did not understand what you were trying to do, or was it the PCP that was not understanding?
So the mental health provider was not understanding what we were trying to do. They were still living in the traditional consultative model, where they wanted us to send a referral, and then the patient would be told to go over to this building for behavioral health services. And we were saying, no, we want you to come to the patient and sit with our PCP teams. And yeah, that didn't sit well with them.
There's a question in the chat from Veronica. She asked, can you share a good source for more information on KPIs for behavioral health services in value-based care?
Yes, I'll send that out through you afterwards. I'll have to reach out to my team and see if they have something more than just a list of the things that we monitor.
Carrie, as you said, moving to value-based care, getting your hands around good data that shows total cost of care is critical. And that requires really good conversations going on between payers and yourselves, and finding payers that are willing to set up data sharing so that can be done on a timely basis. And often the payers have data that lags by up to 90 days that makes it very difficult to implement change. So I'm just curious what your observations have been about that.
Yes, and part of it too is making when they do have data, making that data available to the team that's interacting with the patient as well, right? So for us, we implemented Azara, a population health software, and now we're working with payers to develop the the integration, the interface, so that the data from the payer comes into our Azara population health software. So we initially started this journey by ourselves, and when we shared some of it with our state association, they were excited about it, and so they joined in. And so now we've been working collaboratively with them to identify and prioritize payers and pay for that interface to be built. So I believe we have our third interface that's being built right now. We have one of them that's up and live. And can I tell you how illuminating that has been? In a good way and also in a very stressful way, because so we're in our first total cost of care contract right now. We felt pretty good about what we thought our data looked like, what we thought we were doing. And then once we had the data flowing in from the payer, we were able to appreciate the mismatch. And I'll tell you, we had about 60% mismatch, meaning about 60% of the time, we thought we were meeting a certain metric, but their data did not reveal that we were. The good news is it was about coding. The bad news is it was about coding. and so now we're trying to figure out, short of having somebody who just sits and applies codes all day long, what tools do we have in our electronic health record, or other tools that our teams use that could import those codes? And then also, how do we go back and address the time that's already passed in this contract here, where we have missed using the codes that identify what we have done? So, but having those interfaces with the payers, Dan, has been illuminating. And then we also have meetings, because not everything flows in there. And so we sit and talk through the data as well on a monthly basis, now that we have this total cost of care contract. Oh, and one more piece that's been hugely helpful. We joined an HIE. So we have Greater Houston Health Connect is our local HIE. And so we have the interface built with them. We've been trying to encourage other providers in the area. So one of the major hospital systems has joined, a couple of the other clinics have joined, one of the home health agencies has joined, but we still have one major hospital partner that has not joined. We have tried to sell them on all the great things that it provides, because frankly, for the hospital partner that we do have, since we have the interface built, we can see the hospitalization without having to rely on the patient to tell us. We don't have to reach out and get medical records. Once the patient has opted in, we have access to that information. And not to get too far off track here, but having the patient opt in was another strategy that we had to employ. Initially, we were just counting on the front desk to ask patients, would you like to sign up for the HIE? And of course, there were a lot of people that said no. And so then we had our population health coordinators reach out to patients and say, so we're a part of a health information exchange. Here's what it means. It means when you go to the hospital, you don't have to necessarily tell us right away. We'll know, we can reach out to you, we can be helpful to you, we can make sure you get the follow-up you need. And then people were like, oh yeah, I want that. So we increased the number of people that were signed up for the HIE dramatically once we had population health coordinators with scripts reaching out to patients to help share the value of that tool. What else would we like to talk about?
You know, speaking about coding, one other coding piece that, if you're not using it, I think is very helpful, is CPT2 coding, where you don't have to have the data that demonstrates that you did the A1C. You just document in the notes that it's been done, and you use the CPT2 code to demonstrate that, and the payers have to accept that as proof.
Yes, and depending on which electronic health record you have, I know we're on ECW, and there's a rules engine in ECW that when the provider closes the chart, if the blood pressure has been documented in the correct place, if the A1C has been documented in the correct place, it will automatically drop those codes.
Oh, that's great.
Yeah, so it'll ask the provider as they go to close the chart, would you like to run the rules engine? They click yes, and I realize it's 2 additional clicks, so you have to kind of sell that a little bit, but they say yes, run the rules engine. It'll pop up and tell them here are the CPT2 codes that are going to be added based on the data in the chart. They have to just click yes, and those are the only 2 additional clicks, but it makes sure those CPT2 codes are being added in addition to, right, in recognition of what's being documented. So we're really excited to start using that. I think the one challenge that it is a bit of a change in workflow for our providers, because apparently we didn't, the things you don't know until you know. When we set out to employ this and started talking to providers about closing the charts, we found out a lot of them are batch closing at the end of the day. And if you batch close the charts, it bypasses the rules engine entirely. So we had to go back to them and say, yeah, we need you to close them individually.
Good boy.
So we recognize we might have a few folks that aren't doing that consistently, and so we'll have to have a team that's kind of running in behind them to try to address that for now. But at least it's an opportunity. I mean, particularly if we can start aligning, and this is a conversation for another day, but if we can align our provider contracts with our value-based contracts so that we're recognizing when we're asking them to do additional things and the CPT coding has more value to them, then maybe it'll feel more like a tool to help them than just another couple of clicks that we're asking them to take on.
We have 1 minute left, so before closing, are there any other questions?
So my contact information is in the presentation. Please feel free to reach out if anybody wants to have a chat about any of this, or if you'd like to chat with any of our team. I know we love talking to other folks who are in various stages of development of this. We've been learning so much along the way. I'm sure we will keep learning more, and we love to find other people on the journey so we can learn from them as well.
Victoria, do you want to close this out?
Yes. So as you all know, I will be sending out a follow-up email, including Dr. Sabella's presentation, as well as the link to the recording, and then also the evaluation survey link. So if you could just please fill out the evaluation survey, and then that way I can send you your certificate of attendance after. But that's it. Thank you all so much. We hope to see you next month. And thank you so much, Dr. Sabella. That was a really great presentation.
Thank you.
Yeah. And thank you all for, dealing with our technical difficulties.
Yes,
Thank you all. Great seeing you all.
Goodbye.
Yeah, sorry about all that. I don't know what happened today.
Thank you.